Hepatitis C used to be a name that carried a heavy weight, often seen as a long-term, chronic illness with a grim outlook. But what if I told you that, in recent years, medicine has made a revolutionary leap forward, and today, hepatitis C is considered a curable disease? That's right, curable. Stick around, because in the next 10 minutes, we're going to break down everything you need to know about modern hepatitis C treatment, from how it works to the incredible success rates. First things first, what exactly is hepatitis C? It's a liver infection caused by the hepatitis C virus, or HCV. The virus primarily spreads through contact with infected blood. This can happen through various ways, like unsafe injections, sharing needles, receiving unscreened blood transfusions, or even sharing personal items like razors or toothbrushes that might have traces of blood. In some cases, it can also be transmitted from a mother to her baby during childbirth. When someone is first infected, this is known as the acute phase. Now, let's talk about acute hepatitis C. This is the period covering the first 6 months after infection. An interesting thing happens here. A significant number of people, around 25%, can naturally clear the virus from their bodies without any treatment. Their immune system successfully fights it off. Because of this, doctors often adopt a watch and wait approach. They'll monitor the patient with supportive care, advising them on how to keep their liver healthy, and wait to see if the infection resolves on its own. If the virus is still present after 6 months, it's time to move on to active treatment. So, what happens if the virus doesn't go away? This leads to chronic hepatitis C, which means the virus has remained in the body for more than 6 months. Chronic infection is where the real danger lies. Over years or decades, it can cause serious liver damage, leading to conditions like cirrhosis, which is severe scarring of the liver, and can even result in liver cancer. This is why treating chronic hepatitis C is absolutely essential. And this is where the medical breakthrough comes in. The standard of care for chronic hepatitis C today is a class of medications called direct-acting antivirals, or D. These are not like the old, harsh treatments of the past that came with severe side effects. DAAs are oral tablets, taken daily for a relatively short period, usually between 8 to 12 weeks. The best part, the cure rates are astonishingly high, over 95% for most people who complete the treatment as prescribed. Let's look at some of the most common DA combinations you might hear about. One is sofosbuvir, combined with velpatasvir, sold under the brand name This is a pangenotypic treatment, which means it's effective against all the different genetic types, or genotypes, of the hepatitis C virus. This makes treatment simpler because extensive genotype testing isn't always needed. Another powerful pangenotypic option is glycoprevir, plus PEP. For many patients without severe liver scarring, the treatment course with Maviret is even shorter, just 8 weeks. Imagine a chronic viral infection being cured in just 2 months. It's truly remarkable. There are also other highly effective combinations, like sofosbuvir with ledipasvir, which is sold as Harvoni, and sofosbuvir with Dac. These were some of the earlier DOS, and are often prescribed for specific genotypes of the virus. The key takeaway here is that your doctor will choose the best regimen for you based on your specific virus genotype, the extent of any liver damage, and your overall health profile. The goal is always the same: to completely eradicate the virus from your body. Treatment with DOS is just one piece of the puzzle, though. Supportive measures are also crucial for a successful recovery and for protecting your liver in the long run. The most important one is to completely avoid alcohol. Alcohol is processed by the liver, and when your liver is already under stress from the HCV virus, drinking can accelerate damage significantly. Similarly, it's important to avoid any medications that can be toxic to the liver. Always talk to your doctor before taking any new medicine, supplement, or herbal remedy. A healthy, balanced diet also plays a supportive role. You don't need a super strict liver diet, but focusing on whole foods like fruits, vegetables, lean proteins, and whole grains while cutting back on processed foods. Unhealthy fats and sugar will help reduce the workload on your liver and support your overall health during and after treatment. Another vital step is getting vaccinated for hepatitis A and hepatitis B, if you're not already immune. These vaccines are highly recommended. Your liver is already fighting one battle against hepatitis C. You absolutely want to protect it from any additional viral attacks that could cause further inflammation and damage. Throughout this entire process, Monitoring is key. Your healthcare team will track your progress with regular blood tests. They'll measure your HCV RNA levels, which tells them the amount of virus in your blood. A decreasing viral load is a great sign that the treatment is working. They'll also check your liver enzyme levels, like altanast, to see how your liver is functioning. To assess the degree of liver damage before and sometimes after treatment, doctors use non-invasive tests like This is a special type of ultrasound that measures the stiffness of your liver, which corresponds to the amount of scarring or fibrosis. It is a quick and painless way to get a clear picture of your liver's health without needing a biopsy. So, how do you know if you're officially cured? The gold standard is a blood test called the SVR12 test. SVR stands for Sustained Virologic Response. This test is done 12 weeks after you finish your treatment. If the hepatitis C virus is still undetectable in your blood at this point, you are considered cured. That means the virus is gone for good and won't come back on its own. It's a life-changing moment for so many people. Now, while treatment is incredibly effective, prevention is always better than a cure. Currently, there is no vaccine for hepatitis C, unlike hepatitis A and B. So, preventing infection in the first place is our best defense. The main prevention strategies all revolve around avoiding contact with infected blood. This means always using sterile needles and syringes and never sharing them. It means ensuring that any blood transfusions you receive have been properly screened. If you get a tattoo or a piercing, make sure the facility is reputable and uses single-use, sterilized equipment. And avoid sharing personal items that could have blood on them, like razors, nail clippers, and toothbrushes. When it comes to sexual transmission, the risk is lower than with other viruses, but it's not zero. Using protection, especially if you or your partner have multiple partners or are living with HIV, is a smart way to reduce the risk. So, let's quickly recap the key points. Hepatitis C is a viral infection of the liver. The acute phase can sometimes clear on its own. If it becomes chronic, it needs treatment to prevent serious liver damage. The good news is that chronic hepatitis C is now curable with DA tablets, typically in an 8 to 12-week course, with a success rate of over 95%. This is a major difference from a virus like hepatitis B, which can be managed but not typically cured in the same way. Supportive care, like avoiding alcohol and maintaining a healthy lifestyle, is also essential. And since there's no vaccine yet, prevention is paramount. If you think you might have been at risk for hepatitis C, please talk to a healthcare provider about getting tested. The sooner you know your status, the sooner you can take steps to protect your health and the health of others. Thank you so much for watching. I hope this overview has been helpful and has cleared up any confusion about hepatitis C treatment. It's a story of incredible medical progress and hope. If you found this video informative, please give it a thumbs up and consider subscribing to our channel for more health content. Stay safe and take care.